Good morning and welcome to my YouTube channel Pain Free Partha. Today I am going to discuss something in a short video about response to reviewers. Okay, this is slightly different from a simple MD anesthesia academics. This will be useful also to any person who is in research work and who is in publication. Before that, I would like all of you to subscribe to my channel Pain Free Partha and follow this. Whenever I talk anything on academics, I put a big salute to the legendary teacher of 2 centuries, Professor Ravi Shankar. Greetings from the Institute, Mahatma Gandhi Medical College, Sri Balaji Vidyapeeth. Now we know we respond to a reviewer. Okay, who is a reviewer is a question. Okay, I will come to it later. Now we will know what is the flow of an article. Now you upload an article, okay, to the journal. You have uploaded an article to the journal when the journal's chief editor or editorial board sees it. Okay, if there are some technical modifications, for example, your article is not under the purview or the scope of the journal, he may remove it. Or if your article's same title, almost similar title has been published in the same journal, or your article has got a lot of publications, including more than 20 in PubMed, then he can have the right to reject it. Or if he thinks the abstract name be changed, or if the number of words is not good, if your imitations are not okay, if your references are to be modified, he can tell, or plagiarism is more than 15% or something like that. That depends upon the journal. Or if your artificial intelligence uses more than 15%, something like that, he can have technical modifications. Now it has not gone into the reviewer at all. The editor sends it back to the author as technical modifications. Now the author, what I have written a manuscript and or who have written a manuscript, he uploads with changes. Now the editor sends it to two reviewers because the editor may be from the department of orthopedics or from the department of radiotherapy or something like that. He may be in charge of the whole thing, or even in specialization. For example, if the editor-in-chief is Department of Surgery and the journal is International Journal of Surgery, he may not be very good in onco-surgery. So something like that. So he needs experts to check and review this article. That is what is called a reviewer. He is a peer, means expert. He may be an expert in subject or seniority or others, whatever it is. For example, if you are head of the department of onco-surgery in an institute, then he becomes an expert automatically. It may be others also. For example, the editor can have doubts about the sampling statistics. He may send it to a statistician who is not at all a doctor. So these are all possibles when you refer to peer experts. For example, now you see, I am basically from anesthesia and pain. See here, college female students TSH levels. Estimation pregnancy TSH levels. School children TSH levels. We have got 3 publications. So sometimes if somebody sees this and he can send an article to me about TSH, thyroid and all, I become a peer reviewer. Okay. It is not that the fellow should be in the department only. He can be an expert in a specific field. For example, a neurology or an MD general medicine may be a specialist in Parkinson's. Something like that. He may be an expert in TSH. Reviewer comments is not technical modification. He goes through it. He goes through the methodology. He goes through the introduction. He goes through the sampling methodology. He analyzes the discussion and results. He is blinded to the article. Who has written the article, it should not be there, because sometimes when you upload the article, the CTRI number, registered number, or this 20 patients coming to the Department of General Surgery in Mahatma Gandhi Medical College should be removed. Because if it goes to the reviewer, he will know from where it has come. So that should be not be there. Sometimes it is unblinded. What happens is many of the journals now ask for reviewers, suggested reviewers. Now you suggest a reviewer, a professor of Stanley Medical College, and you tell him that I am sent this article and I have suggested to the reviewer, then it becomes an unblinded reviewer. He knows this fellow has sent this to this journal and suggested my name as a reviewer. So it is not blinded. Convincing two reviewers is publishing. That is what is evidence. If you are able to convince two personnel, so two human beings, then it is evidence. Now there are a lot of reviewer comments. If you agree with the reviewer, we thank the reviewer for point out, we have revised, we have removed. Now we thank the reviewers for this comment. Now we have removed this sentence. And we agree and we have updated. For example, the fellow may tell tickloscopy is better than MRI brain or MRI spine. So then he sees tickloscopy is not a thing, and you have to update like this. We agree with this. We agree with the reviewer. Sometimes you start with a case report of a 52-year-old female and write in the discussion as he. Female, how he becomes he. So you have fixed the error? Yes, fine. We have made the change. If you don't agree with the reviewer, yes, we believe in expanding our data set, which is feasible given the cost involved, nor significantly it will support the argument. That is why we have shortened our sample size. Sometimes one reviewer will say sampling statistics is not good. The other reviewer may say sampling statistics needs to be elaborated. So this type of conflicts will come even among the reviewers. Go to the same point of another reviewer. Another thing is sometimes we are doing a descriptive study. Now, this is TSH study is a descriptive study. How many school students have got hypothyroidism subclinically or clinically? TSH level more than 10, more than 8, something like that. So 10% of the students are having hypothyroid. This is what is, where is the p-value? Nothing. So that means if the reviewer is doubtful about what are the statistics, you cannot describe the statistics, then you can tell. This is a simple epidemiological descriptive study where the p-value doesn't come at all. But still, I think we have satisfied the reviewers. Be polite, grateful, professional. Don't think that reviewer is. Respond to all queries, all instructions. Make it easy for the reviewer and editor to understand your response. If we don't understand his review comment, it is okay to admit I cannot understand what the reviewer wants to tell or what the reviewer wants to ask the author. For example, introduction has got limited references. He wants to increase. Now he sees the methodology needs better description. Now the presentation of author is not consistent. All these things, reviewer 1, 2, 3, all these things, there are so many questions like this. We responded to all the questions like this. Introduction words increased with 2 more references. The nutraceutical in osteoarthritis, varied results have been elaborated. The author's introduction improved. 2 articles added in methodology. So change DOA added if active. References. So many things we have done with answers of the reviewers. Then we can see the article is published. The editor accepts and it is published. This has happened only 2 weeks ago. Though adhesive, see there is one adhesive arachnoiditis, an arachnoid removal done, surgery done, release of adhesions done, and probably his paraparesis has improved. This is what is the case report. And in this, yes, you can tell MRI is a sophisticated investigations or not. So many things are there. Now, the patients in his examination finding has said paraplegia and the title says paraparesis. Now you see here, improvement in detail. Now after doing the surgery, the surgeon has told that this has improved. So what the reviewer wants, what is the objective evidence of improvement? For example, 3/5 motor power has become 4/5. Something like that. He wants clear. Now the dermatome level was T12. Now it has come down to L4. Something like that. He wants objective evidence. Somebody may say references are outdated and recent references are not for our research. Small thing is, sometimes you take up an old topic and present something new. If that is there, so many of your references may be old, but usually if you take on going old references, that means your research is old, your concept is old. That is what the reviewer wants to tell. Now, you have to satisfy the reviewer. Even though the references are old, my concept is good, clear, new, something like that. For example, now you are taking fentanyl, spinal, into the fentanyl. Now, if you are putting thoracic fentanyl in the spinal space here, then it may be slightly new. So we want to convince the reviewers that even though our references are old, our concept is new. Now you can change the references. Some are recent. Tuck, tuck, tuck. 12, 5, 6 changed. So if you change like this, depending upon the references you have written something there in the article, that also we need to change. The discussion has to be modified. For example, you might have written Shelley et al. Has told 15% of osteoarthritis does not need some chondroitin sulfate. That is by Charlie et al. You have removed Charlie et al. Because it is 2017. Now you have to change the sentence in the article itself. Don't fight with the reviewers. Thank the reviewer. Be polite. Be calm. There may be sometimes innumerable comments. You can see 30 comments. Document the airway assessment. Why this patient has seemed to have a difficult airway. Although a rescue plan makes no provision of supraglottic airway, does not seem possible. Adequate mouth opening is there. See, there are so many cases. For example, this patient, we did spinal surgery under spinal. So this reviewer was not very interested in publishing. He was very, yes, see here, he has reservations about being advertised as a technique of those having difficulty. Now he says, I had a plan of ProSeal LMA in the prone position if the patient goes bad. No, he wanted references for that. So I said if there are 50 references, I added 3. So I explained all the things. Yes, spinal surgery can be done under spinal. So combined segmental spinal, yes, it is published Srinivasan Parthasarathy in BMJ. Now the reviewer has told no previous reports of catecholamine surge occurring during nephrectomy. Is probably not true because 2023 there is pediatric case report article. Now we have to tell the reviewer we have uploaded the article in February and this is in March. So then we have to change. Yes, we have got it later. I will change it. I have changed. No history, no preoperative workup. What was the ultrasound finding? CECT, MRI, what were the reports? All these things we have to add. The 5 microgram adrenal intestine, so many things, 4, 5, 6, 7, 8, 9, so many articles, so many references, so many questions. At answering all these things, now you can see transient severe hemodynamic disturbance. We have got published. Somebody doesn't want the title only. I have my own site of neonatal resuscitation. If you just do it bilaterally, the baby is going to cry, even if it is somewhat. I think what we felt in this is the nociceptive input from here is more rather than the back. That is what we promoted as the possible etiology of this site being better in stimulation of the neonate. So he was very this thing about don't put the Partha site, remove this novel site is enough. So we have to convince, and after that it has appeared. Now we have to make a table like this. The reviewer comment reference is not correct. Now what we have done changed. Where we have changed. Abstract needs structure changed. First page. Figure 3 is not mentioned in the article. Changed. Second page, line 6. Whatever the change you are making, you make in a different color. The diaphragm contributes. See here, there is an article on acute diaphragmatic palsy after superficial cervical plexus block, and it presented as bronchospasm. Now, the editor was not very satisfied. Now you see, he again sent it. The editor has got the power to send it back to another reviewer after 2 reviews. So there we need to change by adding different colors. First red color, second again blue. Now this is accepted here. Manuscript acute severe bronchospasm. Let our tone be modest with conversational sentences rather than formed short sentences. Formal. I have done this. I have done this. I have changed this. Not like this. So as requested by the reviewer, we have modified the sentence in such a way that the reviewer is satisfied. Something like that. Well, that. Finish that. Don't do short formal sentences. We should admit that the reviewers are doing free service to the specialty. He spends time or she spends time, reads your article, and then puts the comments. For what purpose? Nothing. Maintain anonymity. The response, yes, very important. Now your answer is to the reviewer's comments is there. Now you have uploaded. The uploaded article does not go to the reviewer. It goes to the editor-in-chief. That is what we should know. It doesn't go back to the reviewer unless he asks for it. It goes back to the editor. If the editor is satisfied, with your responses of reviewer's question, it accepts immediately. But if the reviewer is not much satisfied, no, editor is not much satisfied, he can send it back to the same reviewer or a different reviewer and analyze and check. Now, this is what the study we did. This Kaparis Zelenka. This is what is called Adandaka. We used to take only once in a year in the new moon day of Adi month. That happens in July, August. So this doesn't become ripe. It is an unripe fruit. So it will be very bitter to taste. But they have told to take this at this new moon day of Adi month once in a year. So we went ahead to researching this. What is there inside? A lot of B12 was there and it got published. But the reviewer asked, how can a plant get B12? Then we have to go into the details and tell the reviewers and satisfy the reviewers that B12 can happen in plant as a source if the cow dung is used as a manure. This was the suggestion given by us. Then with evidence, then we accepted and published. We had another article, okay, another manuscript, we sent the manuscript about the lifestyle of college students. Now what we had prepared 11 points. He goes to sleep early, he takes fast food, so many things, 11 points, in which alcoholism was there. Alcoholism is a routine alcoholism was a bad quality of life according to us. But the reviewer told, no, change the thing, 3, 2, 1 into 1, 2, 3. Alcoholism is a good lifestyle. This is what the reviewer told. Now we should not get offended, we should be polite. Then tell alcoholism is not like that here. There are a lot of problems. How does our alcoholism work? How young students are becoming bad? All these things we should tell, explained it to them. And then what happened was introduction and validation of a new Sujitra scoring system. This is Cures 8. And I was the author. Now sometimes 40 questions in the first review and another 40 questions in the next review. Don't bother. Answer your questions, again go to analyze and then give, then only you will get this response and it gets published. Understand the way as now you have prepared a response. Some journals you get to see, click the due and it will show the upload the new article, upload the comments file, yes, submit, it will go. This is in some journal. Some journals where Medno journals, you have to add the new file and delete the old file and you have to add the file. This table we have put, no, that table should be as named as comments to referees, comments to reviewers, and then upload it here. Always read author instructions. Author instructions, for example, 1500 words, 6 references, 1 image, means you stick to that. Unnecessarily, it will create problems. If the review article has got 4000 words, stick to 4000 words. Sometimes your manuscript submission, after all these things, will become like this. When you again read the article again before sending, is it exactly conveying of what you wanted? That should be guaranteed. And otherwise, you should again satisfy the reviewer and make it slightly like this, but not like this, so that you get confused of what you want to say. Take a calm approach, comprehend, answer, list all your answers, and mind your answers. There are two rules in response to reviews. Rule 1, the reviewer is always right. Now, if you think reviewer is wrong, rule 2, if you think that reviewer is wrong, go back to rule 1. Any doubts? Visit my website, Pain Free Partha, my YouTube channel, Pain Free Partha. Thank you.